I'm Dr. Chua from Gleneagles Kuala Lumpur, Malaysia. I've been actually involved in stem cell research and therapy for at least 20 over years. All right. Now, over the time when I'm actually a consultant anesthesiologist in Gleneagles, I also look after the intensive care, and we do quite a lot of critical care medicine. It is from my experience in the intensive care and critical medicine that I decided that there has to be an alternative to the conventional medical treatment that we use in the intensive care, because we can only help as much as possible by either using drugs or using some other device like putting the patient on a ventilator to help with the breathing. But eventually, the patient needs to be out of the ICU and go home. Now, majority of the patients who have severe medical condition that requires intensive care, some of them actually end up with brain damage. They end up with some significant heart failure. That means the ejection fraction has come down. The heart is not able to pump properly. They may even have a kidney that has been severely affected by the condition, that also may have required acute hemodialysis to bring to help with the improvement in the kidney function, and also other organ function like the liver. And over time, the longer you stay in the ICU, your muscles get atrophied, you become weaker, you can't move much because you have lost a lot of muscle strength. And because I was looking for what other therapy can strengthen and bring the body back to whatever the body can do before the medical condition that caused the admission to ICU, there's only one way, that is by using cell therapy. All right. So 20 years ago, when stem cell became a common buzzword in many parts of the world, I look at the properties of the stem cells and the ability that it can help in repair, regeneration, regeneration, and I seen it happen since I started 20 years ago. I've helped patients with heart failure. I've helped patients with brain issue like stroke, hypoxic encephalopathy, that I am now convinced that stem cell is and will be a part of treatment for any major medical conditions. And I will continue, and over the years, of course, I've expanded my role in helping even with kids, like with neurodevelopmental, or even with any kind of insult to the brain. Because as a consultant anesthetist, as I mentioned in another earlier podcast, that I am the expert in spinal injection, and the spinal injection is one of the important and safe route for delivering stem cells to the brain or the spinal cord and central nervous system. The science of cellular therapy, especially stem cells, and the subspecialization in producing cells of different organ-specific stem cells will improve over time. And I believe that with the improvement in the technology, the type of stem cells, and the ability to deliver stem cells closer to the organ of intended use, all these major medical conditions that have no way of improving can be helped with developments that are coming online.